All right, so I can go now, right? Perfect. All right. So hi everybody. Thanks for the invite. Thank you for having me. My name is Dr. Ravi Sutaria. I'm a rheumatologist, and I'd like to discuss some common rheumatic conditions, as well as some chronic conditions causing pain of certain joints, and certain tendinopathies that kind of arise as either time or usage related. So just first a little bit about myself. I'm a board-trained rheumatologist. I've had the pleasure of training in both urban and rural settings, which has given me kind of access to all kinds of patients from all kinds of backgrounds and all kinds of age groups. Being in the big city, we also get to see some of the rare stuff more regularly, which keeps us on our toes, which is always interesting from certain standpoints. Interest-wise, my first interest was in viral arthritis or arthritides. I did a lot of my research into the effects of chikungunya virus on joints, um, which then translated into research into COVID and joints, as there was a lot of overlap, which was kind of unexpected as we all kind of were caught out of the blue with the pandemic. I also have an interest in MSK ultrasound, which is a great modality for diagnosing and treating patients with both inflammatory and arthritic conditions. I have a partnership with physiatry in the sense that I actually work with my wife, who's a physiatry physician. I mention that because in rheumatology, there's so much emphasis on bone, joints, and basically the treatment of those bone and joints through medications and interventions like injections. And working with a specialist like a physiatrist has opened us to so many different modalities that combine diet, exercise, mindfulness, mentation, in conjunction with medications and interventions that are needed. So kind of a more holistic, more musculoskeletal total body approach than just saying this joint is sick and this joint needs help. So I think that more broad approach is both helpful to patients and physicians alike, as well as safer, as it's not just medications and their side effects. Um, Interest these days with telemedication. We want to bring access to patients who can't see specialists. I happen to work in New York City, where there's a shortage of rheumatologists, which is a shock because doctors are a dime a dozen in a city like ours. So, working with telehealth and bringing access to patients, and also managing the fact that we can't always see all of our patients. So, how can we help our patients in an effective way without overdoing it, missing something, or doing harm in the setting of not being able to physically examine? So bridging these gaps is going to be interesting in the future and something that we're looking forward to be a part of. So without further ado, what are some common rheumatic conditions that we treat? So, of course, OA, run-of-the-mill osteoarthritis, the condition of kind of informally use it or lose it arthritis. The types of arthritis that may be from overuse, from certain activities, from certain histories, like being a runner, being active in the past, or in this day and age, just usage-related injuries. You work on your feet, you walk a lot, and thus you might have osteoarthritis of the knees. Inflammatory arthritis are more disease-based and come from the immune system. The most common example is rheumatoid arthritis, and this is important as it has a bimodal distribution starting for majority of patients after the age of 40 and then after the age of 60. What makes RA different than OA is that it's not a usage-related injury, and that it has some specific highlights which are unique to osteoarthritis. Osteoarthritis might be monoarticular, meaning you have a history of injury to your right knee, you use your right knee a lot, it develops right knee osteoarthritis. Rheumatoid arthritis is more symmetrical, so it might affect both knees or both hands or both wrists. It is often associated with morning stiffness that lasts 15 minutes or more, and there's a characteristic synovitis of the joints, which is a swelling of the covering or the tissue that surrounds the joint, the synovium. This causes the appearance of the joint being swollen, full, and it gives warmth and tenderness to the joints, which might be different than an osteoarthritic process. Other types of inflammatory arthritis are not limited just to RA, but can include something like gout, a crystalline-based arthritis, or CPPD, a calcium-based arthritis. These type of arthritises come from essentially crystals in the blood that precipitate out due to different reasons. In gout, the uric acid crystals precipitate and get stuck in joints, causing exquisite tenderness, exquisite pain, exquisite warmth, and what we call point tenderness. Basically, light touch of the joint might elicit 10 out of 10 pain. The joint may also have, quote unquote, a fever and feel like it literally may be over 100 degrees because it might actually be so due to the inflammatory cascade. Gout often is precipitated by diet. Shellfish is often a culprit. Types of alcohol, more so whiskey and brown-based liquors than clear liquor. Beer also is high in uric acid. All alcohol is high in uric acid, but clear alcohols such as vodka and wine would have less uric acid than whiskeys, bourbons, and frank beer, which have more uric acid. Gout can also be caused by under-excretion. So as your kidneys get older, perhaps are afflicted with a problem such as hypertension or diabetes, or just genetically, they may not be able to process the uric acid, and gout may develop from the inability to remove uric acid from your blood and not from your diet. So it is also important for you to maintain good health through exercise, to maintain perfusion through these joints, in addition to maintaining a healthy diet, low in the things that might be high in uric acid. Other types of autoimmune inflammatory conditions we treat would be lupus and kind of the cousins of lupus, scleroderma, Sjogren's syndrome, mixed connective tissue disease. These conditions also cause joint pain and joint swelling, but for example, lupus would be more associated with rashes of the face, alopecia, missing hair, photosensitivity, extreme fatigue, and Raynaud's, a phenomenon where your fingers turn white, pink, or purple when exposed to the cold. Sjogren's would be more associated with dry eyes and dry mouth, and mixed connective tissue diseases would be a combination of joint pain, joint swelling with skin involvement and at times organ involvement such as the kidneys. To go on, rheumatologists also treat conditions called spondyloarthropathies, which include psoriatic arthritis, which is arthritis inflammatory in the setting of psoriasis, inflammatory back disease, which is back disease that occurs generally before the age of 40, associated with inflammation, often causing spondylosis, back immobility, stiffness, swelling, and degeneration of the lumbar, thoracic, and cervical spine at a rate more advanced than regular degeneration or osteoarthrosis. Finally, spondyloarthropathy is closed out by IBD arthropathy, which is becoming more and more prominent this day and age. Inflammation of the gut actually causing inflammatory arthropathy. We're going to talk a little bit more about this, as there is a strong correlation between the gut microbiome and types of arthritises, and we're kind of only scratching the surface with this, but the understanding is there, the full knowledge and how to apply this knowledge to impact and treat inflammatory disease is still kind of evolving, and we're very excited about that. Finally, as my interest is in post-viral arthritis, before COVID, flu, and any type of virus, for example, hepatitis, upper respiratory infection causing common viruses, can actually mimic inflammatory arthritis. And basically 3 to 6 months after getting a viral syndrome, for example, flu or COVID, you could basically have a inflammatory arthritis mimicking, let's say, rheumatoid arthritis for 3 to 6 months after viral exposure. In these cases, supportive care is most common, but sometimes we would need to help a patient and almost treat them as if they had rheumatoid arthritis for 3 to 6 months until the viral particles are fully shed. So that's just a brief overview of some of the things we treat. And obviously, there are some more nuanced things that are a little bit less bread and butter that we don't need to discuss right away. So what are some common comorbidities? Of course, this is throughout the US. Our heart and cardiovascular health affects our joint health. So comorbidities in inflammatory and regular arthritic conditions do include hypertension, hyperlipidemia, of course, obesity, as weight is taxing to our joints. During my fellowship, there's one interesting fact that I learned that losing 1 pound reduces about 5 pounds of pressure from the knee. So yes, you might say I only lost 1 or 2 pounds, and you may not feel so emboldened or so great about that fact. But if you think about it as losing 5 to 10 pounds of pressure from a knee that might have osteoarthritis, that's actually is a big deal. And then compound that by losing 5 pounds, now 25 psi off. Well, that doesn't sound like such a small number. So exercise and diet constraint is such an important part of all of this. Smoking is actually pro-inflammatory. Smoking actually, believe it or not, causes rheumatoid arthritis because in cigarette smoke, among the thousands of things that are in there chemical-wise, there is actually rheumatoid factor. So it instigates your immune system to produce more rheumatoid factor, which is immunogenic to joints and inflammatory towards joints. So, what you put in your body orally or through vapes or through direct inhaled smoke makes a huge difference. Underlying diabetes is pro-inflammatory and compounds all of our treatment plans as well as our treatment outcomes. Patients with uncontrolled diabetes, unfortunately, have worse outcomes in psoriatic arthritis, in rheumatoid arthritis, and other conditions. And so good sugar control, not only through medication, but diet, mindfulness, and intake is very important. Bone health goes hand in hand with bone strength. So osteoporosis is often found in conjunction with all types of arthritis. And of course, with osteoporosis, bone health is maintained not just through calcium and vitamin D supplementation, but also through moving blood to the bones. The bones are an organ system. So how to get blood to them? Well, exercise, increasing pressure through increased heart rate, which then brings blood and nutrients not only to the bones, but the nerves and all the tissues surrounding, which is so important to maintaining homeostasis. Now more than ever, there is a direct correlation and emphasis on the mind and body relationship and symbiosis. Mental health affects all of our conditions. This is not an opinion, but a proven fact that we see specifically through autoimmune conditions such as lupus and specifically rheumatoid arthritis, where we've actually correlated levels of cortisol to depression, which also correlates to frequency of flares. So mental health is important for an infinite number of reasons, but we have now data that shows mental health can impact your joint health as well as directly your immune system. And it's very complicated pathways. Of course, the immune system is quite redundant, but the kind of shortest way to explain that is depression and stress lead to cortisol. Cortisol is pro-inflammatory, toxic to joints, toxic to your immune system, toxic to your heart, toxic to everything. So common medications. So it is not our goal as rheumatologists, common to sometimes what may be believed is that, there is not just a pill for everything and just a shot for everything. There are patients who require chronic medications and interventions, of course, but there are many different approaches to different types of arthritis. And not everyone has a cookie cutter approach where first you take physical therapy and then you take medicine and then you take injection. There's a role for everything at different times, but we must emphasize that majority of chronic conditions that are not disease-based but usage-based will have better outcomes through things like cognitive behavior therapy, physical therapy, exercise therapy, stretching, yoga, as these chronic modalities will maintain musculoskeletal health better than any pills can, especially because of the limit of side effects that would be through those different modalities. So what are the different modalities? Well, of course, there are medications. So over the counter, everyone's familiar with the COX-1 inhibitors. This would be your run-of-the-mill Aleve, Motrin, ibuprofen, all the generic non-steroidal anti-inflammatory drugs. Well, these are wonderful to get people out of pain, to get people out of a bind, and often to reduce inflammation that may arise. However, chronic use of these drugs, as we know, causes acute and chronic kidney disease. These drugs for patients with chronic conditions such as hypertension, hyperlipidemia, diabetes, also interact with the treatment of these conditions, so they can cause your kidneys or liver to become tired a little sooner because of what we call polypharmacy, overuse of medication. And finally, with NSAIDs, our biggest concern is always heartburn. Even one pill can cause it, but generally speaking, chronic usage will cause it, which is why we advise short-term usage of these drugs when they're used, and we also advise eating them on a full stomach. COX-2 inhibitors are the ones provided by your doctor. These are less toxic to your stomach, but still can cause gastritis and kidney injuries. Examples include meloxicam, diclofenac, and can be used in conjunction through guidance with your physician. Topical treatments don't get absorbed, so will limit your side effects to your kidneys and GI system, and generally are considered quite safe, as you would really need large amounts of gel to affect yourself systemically. These include over-the-counter Voltaren gel, also known as diclofenac, and various types of over-the-counter creams, from Bengay to Icy Hot to capsaicin cream, which is derived from peppers. Intervention modalities for different types of arthritis, such as osteoarthritis of the knee and shoulders, can include steroid injections, which can cause blood pressure and blood sugar effects. So different types of injections we use that don't have those side effects include PRP, plasma-rich platelets, for patients who are the right candidates, meaning you don't have end-stage arthritis that requires surgery, can be candidates for things like PRP, which takes your own regenerative cells, spins out the red and white blood cells, which in this case would not be necessary, uses that supernatant and re-injects it back into the joint to suppress inflammation and provide growth factors. For the right candidate, this can be great for multiple joints, from knee to shoulder to ankle to even elbow. Gel shots or viscosupplementation is a generally side effect free, because it's not medication, way to address chronic arthritis in larger joints such as the hip, knee, or shoulder. In this particular case, a series of injections of what can be best described as gel or jelly, not medication, gets injected into the joint to provide lubrication and a cushion that lasts for 6 to 12 months within the joint. It's typically injected with ultrasound, so we know where we're putting the medication, and then it's designed to essentially bind your cartilage to stay within the joint for actually up to 12 months, but we give a 6 to 12 month window where you would again get that cushion and lubrication. An example I would give my patients is, you now have a small pillow for your knee to walk on, whereas that pillow used to be your cartilage. As that's thinned out, we've now put that fake cushion, fake gel, fake jelly, fake pillow there for 6 to 12 months at a time. It's inert, so there shouldn't be any side effects to your system. Finally, some new therapies that exist that compound on old therapies: nerve ablation, finding the nerves that cause chronic pains and arthritis in areas like shoulder, hip, or knee, and simply kind of sounds barbaric, but using electrical signals to ablate or burn them away. And now we have a less barbaric technique called iovera, which then freezes the nerve for 3 to 6 month periods, after which the nerve can regenerate, and sometimes the pain won't be the same at the same levels. If the pain does come back, the procedure can be done again safely, because again, this is now a freezing procedure, and so can be done more frequently and less side effects than ablation. Different types of arthritis can also involve durable medical equipment. Bracing short-term, never long-term, as bracing long-term will inhibit range of motion and will not be good for joints, but short-term, that can always be arranged, as well as things like walkers, walking canes, etc., based on the need and type of arthritis. Finally, and this is kind of more on an individual basis, but disease-specific treatments. If you have osteoarthritis, of course, we're going to focus on exercise, stretching, physical therapy, occupational therapy, and rest, ice, compress, and elevate first before we move on to secondary modalities. However, if you have something like rheumatoid arthritis, physical therapy would not be enough to suppress inflammation. That's when we get into disease-modifying anti-rheumatic drug treatment. So in addition to combining with anti-inflammatory diet and anti-inflammatory methodologies, we would give you specific anti-inflammatory disease-modifying anti-rheumatic drugs for conditions like lupus, psoriatic arthritis, rheumatoid arthritis. Drugs like colchicine are used for gout and pseudo-gout, CPPD, crystalline-based arthritis to reduce flares. And these drugs act rather immediately, as if you have ever had a gout or pseudo-gout flare, you would realize, you would understand how urgency of treatment and addressing these issues is extremely important. Disease-specific treatments for fibromyalgia are very important as well, as fibromyalgia is a multi-systems-based approach where there is medications for pain. There's medications that support mental health, like antidepressants, and there are modalities that focus, on cognitive behavior to reduce generalized pain, as well as exercise and even sleep regimens. There was a study out of Brigham Young of 60,000 women that showed 30 to 50% of fibromyalgia symptoms can be alleviated through adequate sleep, which can include, for some people, 6 to 8 hours of sleep per night. Some people need 8 or more, even though it's generally recommended 6. So adequate sleep, and then a regimented course of 30 minutes of aerobic exercise daily or every other day based on your physical capabilities. So just sleeping enough and aerobic exercise can reduce 30 to 50% of chronic nerve pains that's not disease-based. So that's kind of incredible. And then we can supplement that with other modalities. So, there's the part that we, the doctors, of course, can supplement and help you with. And then there's the part that the patients can help themselves with, as well as we can certainly advocate for as well. So what can we do? As we understand, just a diet is not going to remove rheumatoid arthritis, but diet alone can stop gout. Now, of course, there'd be a scenario where certain types of patients can't excrete the uric acid, but a majority of gout, 60 to 70%, for example, would be diet related. So we'll try to touch on some techniques that focus on anti-inflammation in your diet. Again, there are multiple studies, one of which highlights the fact that an anti-inflammatory diet for rheumatoid arthritis patients actually reduce the number and frequency of flares. Nowadays, just anecdotally, we have cases with access to our newer medications, such as Ozempic and Wegovy, where we've had patients, due to comorbidities of diabetes and heart disease, lose over 100 pounds. And we've actually, in isolated cases, stopped all rheumatic treatments because the lack of inflammation coming from the patient's new homeostasis or new balance did not require their RA to be treated with medication, but rather observation physical therapy. So, of course, these are extreme cases. These are new things that we're discovering. But my point here is not that losing weight will get rid of your rheumatoid arthritis. It's to highlight the correlation between inflammation and inflammatory arthritis. Inflammation comes from diet. It comes from stress. It comes from weight. It comes from many different things. And not just an immune system genetic problem. So that's kind of the focus. And then what we'll later touch base on is that inflammation now, as we understand, also comes from your gut, and not just, let's say, eating McDonald's every day, but not having a balanced diet. Whereas you might be eating healthy, but you might not have the right proportions of healthy ingredients. And this doesn't promote a good gut biome, which in turn is inflammatory and can cause a host of problems, not just diabetes, but arthritis related as well. So what are the recommended anti-inflammatory diets? Well, the stuff we all know about: lean and white meats, fish and poultry, of course, are always going to be emphasized. Yogurt is so extremely important. Now we know, milk-based products this day and age do have an inflammatory component, but yogurt is a probiotic. And yogurt will promote the gut microbiome to maintain a good balance of the good and bad bacteria, to promote an anti-inflammatory or a uninflamed gut, which then promotes a healthy immune system. Whole grains, green teas, chickpeas, leafy greens and fruits. Now, I'll be the first one to tell you I'm not a nutritionist. So the first thing we do when we meet a patient that we've diagnosed with an inflammatory condition is to highlight the importance of mental health, emotional health, and dietary health, and that there are, just like there are specialists for your mental health, there are specialists for your dietary health, and there are things that a dietary specialist will just know that a rheumatologist doesn't, because we don't get to talk about this in extent with all of our patients. So please do understand that there are lots of specialists, nutritionists specifically, that can aid us in our journey, and it's just a wonderful asset to have. What do we not recommend? Well, when somebody comes in with things like gout, well, it's very easy to say, hey, stop eating red meat, stop eating shellfish, such as shrimp, lobster, and stop binge drinking at barbecues. But in reality, the immune system and situations are a little bit more refined than that. First and foremost, except for extreme situations, we would never really ask anybody to stop anything. I think life is, moderation is important in life. And I find when you start doing things like excluding things altogether, it doesn't lead to a sustainability. For some people it does, but for the majority of us, we're all humans. There's going to be good and bad days. But if we could limit or portion red meat, that's going to be excellent. Portion our control and intake of inflammatory vegetables. Tomatoes, unfortunately, in the last 5 to 10 years have gotten a very bad rap. It is true, they are pro-inflammatory. We have isolated many lupus flares simply from tomato intake, because it's a very popular vegetable, and very popular in a Western diet. Tomatoes, and then of course salt and sugar is pro-inflammatory. It leads to hypertension. It leads to an imbalance of homeostasis, which then propagates immune imbalance. So what are the concepts? Well, maintaining low omega-3 to polyunsaturated fatty acid ratios actually reduces inflammation. The generalized concept here is that saturated fatty acids basically are complex. And again, I'm not a nutritionist, and I'm trained in immunology, but basically the concept being, the more complicated a molecule is, the harder your body needs to work to break it down. The more your body needs to work to break it down, the more your immune system will involve not just dietary and genomic factors, but immune factors to break down things in your diet, in your gut. This leads to the inflammatory cascade being activated, and essentially inflammatory conditions are not just specific problems of your immune system, it's degrees of activation of your immune system. So now let's say you're genetically coded to be predisposed for RA because you have a family history, but you're 40, 50 years old and it's never been an issue. But now let's say you've retired and there's there's a little bit of a less of a worse diet, maybe less work, less activity, more stagnation. And now all of a sudden rheumatoid arthritis develops because the balance in your body is now, your homeostasis is off, and inflammation in your body is now promoting the underlying genetic inflammation to reach a certain threshold to cause active conditions. So controlling what you can monitor by keeping a balance of your diet is extremely important. And then, of course, some things cannot be modified, such as genetics. So that's out of our control. Things like nuts, avocado, sesame, and olive oil are very important anti-inflammatory as well. And avoid pre-cooked red meats, processed meats, frying, etc. Prebiotics, probiotics are great. I think the take-home message here is that this can come through your diet. However, if you have a hard time with dairy or other things that are probiotics, you can get them in capsule form. But the concept of probiotics is we need a regular exposure, as the body's gut genomic bacteria are turning over quite frequently. Natural vegetables, green leafy fruits, juices made from leafy greens and fruits will promote this process. High fiber foods reduce colonic transit, also drags bad bacteria, and prevents colonies of bad bacteria from forming by moving the gut along. Enzymatic fruits such as pineapple, mango, and papaya, and grapefruit are excellent. Remember, grapefruit, depending on what antihypertensive medications may have interactions, so always discuss grapefruit with your cardiologist before including in your diet if you don't have so. Glycoalkaloids have been reported to affect intestinal permeability. Why is this important? A leaky gut causes bacteria to go into our system, which is then pro-inflammatory, which then activates our immune system and can activate everything from hyperlipidemia to diabetes to our joint balance and arthritic pains. We've known this forever. Sugar is bad for joints. Sugar is bad for everything. So maintain that. Sugar is linked to obesity and an imbalance of the microbiome, and it promotes an inflammatory state. So just an example of a diet. Again, I won't get too much into this, but the concept being multiple small meals that include green leafy vegetables, for example, starting with a smoothie, which is low residue. For breakfast, having healthy whole grain oats balanced with fruit, but again, in a portion control, followed by just a few hours later, a small snack, followed by a balanced lunch, which is balanced with protein, again followed by small snacks, and then a dinner. So your main meals are supplemented with snacks. This promotes GI motility and promotes nutrients throughout the day, which is healthier than large binge meals. Remember, there's always a relationship between your mind and your body, as well as your body and your mind, both ways. So just like you can listen to your mind that, hey, today's a rainy day, today's a tired day, today I'm feeling kind of, it's foggy outside and I'm feeling that. Well, joints feel that too. So listen to your joints, listen to the feedback your body's giving you. We always advocate for exercise and activity, but there are certain days where your body's saying, today's a rest day. Today's an ice day. And today is more of a stationary bicycle day rather than a run outside day. So there's always a way to balance and not just stop exercise, but limit certain types of exercise if that's the feedback your body's giving. Now, just so, as an immunologist and a rheumatologist, the biggest thing I tell newly diagnosed lupus and RA patients is that the majority of flares you will get in your life will be through stress. Stress comes from physical stress, stress from work, mental stress, stress from life, stress from family. But all of that stress manifests into cortisol, which then manifests into pro-inflammatory active conditions. So stress management is always going to be extremely important. There are mindful-based stress reduction programs, some of which are regimented. For example, 8 weeks of online or in-person practice, which will highlight things that we can control: cognitive behavior, how we process an external stimulus, and how we emotionally process that, and how our bodies process that, and how we take these stimuli and what we make of them to moving forward. So these things, these MBSR programs, mindful-based stress reduction programs, have not only helped patients with osteoarthritic processes, but they've helped across all patient populations. And tangentially, we've been able to prove that in our inflammatory patient populations by actually measuring the ESR and CRP, the levels of inflammation in patients' blood when they're stressed, when they're not stressed, and after they've been exposed to these mindful meditation techniques. So this is just kind of a cascade of stress leads to a reaction. That reaction can be a healthy or unhealthy one based on the way we can control stimulus. Now, certain mental stimulus we can control on our own. If somebody hits us with a hammer on our knee, no one's going to expect you to say, well, I'm fine. That type of reaction of your nerves, is involuntary and cannot be controlled, and it's on autopilot, and it's going to activate a trigger of nerve pain, of emotional stress coping mechanisms. However, physical stress from work or stress from just our daily lives, the way we process that, our reaction to it can help manifest less of an inflammatory cascade through again, mindfulness and stress coping techniques. There are multiple kinds of mindful meditation, which can include love and kindness meditation, breathing meditation, meditation through exercise, such as sitting and walking meditations. Examples include yoga, which includes gentle stretching, breathing, and mindfulness. Benefits, of course, have joint and spinal flexibility, muscle strengthening, posture awareness, improving both vascular and lymphatic blood flow. And this may also help reduce stress, anxiety, and depression. Tai Chi, acupuncture, there are so many modalities now, all of which improve balance, joint flexibility, stability, and mindfulness. I'm going to skip over this, but multiple examples of, excuse me, sorry, multiple examples of mindfulness meditation videos that we could find online on YouTube or through various resources, through even the Arthritis Foundation. And this is just a brief final slide of some links that can lead to some more information. And then lastly, just to touch on some herbal remedies. So, as a rheumatologist, we understand this day and age, patients are on lots of different medications. We are fans and believers of supplements and herbal remedies, but they must be discussed first, as the majority of them not just can cause side effects, which we're not really fully worried about. It's the fact that they interact with drugs. The most common example I can give you is patients on blood thinners. There are certain supplements that stop blood thinners, so your blood won't be thin as desired, whereas other supplements overly thin the blood, which can be dangerous for a different reason. So, that's one example of why you just want to discuss some of these supplements. But the one that we are big proponents of, with I think 19 or more medicinal properties, is turmeric. The active ingredients are cumin. In joints is anti-inflammatory. It treats pain. It treats hyperlipidemia. It treats cortisol levels. It treats hypertension, among 19 other things, which I can't even fully remember right now. There is a limited side effect profile. And this compound can be taken through your diet or can be supplemented in your diet. It is not how much you take, but it is generally a regular or every other day or weekly exposure that leads to these anti-inflammatory effects. So remember, taking something for 1 week every single day in high doses and then stopping is actually not beneficial, whereas a small or limited exposure to something more long-term, generally through more natural ways, like including it in your diet rather than including it as a pill, has a better chance of absorbing and making a long-term difference. Aloe vera, boswellia, slippery elm, all of these things have a role for gut inflammation, which then will have a role for joint inflammation. Again, please do discuss if you're on other medications with a healthcare professional, because the interactions between drugs can be significant. So, I know I kind of went a little bit fast. Rheumatology is a very broad field. So at this point, I'd like to open it up to any questions. And thank you for your time, and thank you for listening.
Thank you so much, Dr. Ravi. So if anyone have questions, welcome to raise your hand and I'll call on you and you can unmute. Rona?
Hi, my family member has arthritis, and if I wanted to find a new rheumatoid arthritis doctors for my care, what would it look like for my family member to start off?
Yes, that's a great question. So generally speaking, if you have a question regarding joint pain, joint health, musculoskeletal issues, discussing with your primary care doctor is always a great start. And making sure you're doing all the things that they can control through diet and exercise. This day and age, because access to even your primary care may not be as easy, telehealth can be an important first step, as certain questions can be screened or asked through a specialist without having to wait 3 to 6 months to get in certain specialties offices. Furthermore, often specialty requirements from insurances involve an authorization from a referral from your primary doctor. So speaking to your primary will be helpful. Using telehealth alternatives is certainly another alternative.
Thank you so much.
Thank you. That's really helpful.
Thanks, Rona. Susan, Angelica.
Hi, thank you for taking my question. And first of all, I want to say that this was a great presentation. You really touched everything that it's of interest. I have all of them: rheumatoid arthritis, osteoarthritis, osteoporosis, and I'm living with them for 20 plus years.
Wow.
My question is now, I'm on methotrexate for the whole 20 years, but I was on Enbrel for maybe 7 years.
Sure.
And now all of a sudden, it seems like that Enbrel doesn't work anymore. So my rheumatologist put me on Orencia. Any idea or research why one treatment stopped working?
Sure. Yeah, sorry.
Yeah, after some time.
Yeah, first of all, thanks for sharing your journey. That's never easy. Multiple chronic conditions, how to manage them, how to balance them, especially understanding that osteoarthritis has a certain approach, rheumatoid has a certain approach, and then that's all compounded by the osteoporosis, which of course in women after menopause is compounded by other processes. Um, thank you for sharing your journey. And then your specific question about Enbrel is a very interesting one. So as the 90s have passed and the 2000s have gone on, certain different classes of biologics have become available. The first generation Enbrel Humira, the TNF inhibitors, are excellent drugs that suppress the inflammatory cascade. But at the time they came out, we fully didn't understand what exactly we wanted to do. We understood that inflammation arthritis comes from inflammation and that we want to stop this inflammation by using a drug like Enbrel. But we kind of stopped it generically at the top of the waterfall. Now, through drugs like Orencia, which is a CTLA-4 molecule, we don't want to stop the top of the waterfall because we want some water to come down for other reasons. We need water in the body. So now we want to stop just the part of the immune system that's doing rheumatoid. So what we discovered is that the TNF molecule of Enbrel is not as specific as the Orencia CTLA-4 molecule, as that one turns off your more rheumatoid-specific cells. Now, why did your Enbrel work and then subsequently stop? That also, as interestingly, we found out with time, your body, your immune system makes anti-drug antibodies. So it gets used to the thing that's fighting your rheumatoid arthritis and sometimes can even make antibodies against the drug itself because you're constantly exposed to the drug on a weekly basis. And the body says, hey, well, on a weekly basis, this is being introduced to us. Now we think that this is part of the problem. So we're going to neutralize this medication instead of letting it help us. So that's maybe one of the reasons. And now there's actually testing for that we can do to help prove these type of things.
Thank you very much. This is the most interesting answer that I got. And I asked this question for many, many years, but this is right to the point. So thank you very much.
My pleasure. No problem.
Appreciate it.
Thank you for asking the question. Any last minute questions? Anyone? Well, we have Dr. Sutaria here. If not, thank you. Thank you, especially for the participants. I know we have some technical glitches. Apologies. I'm glad you were able to make it. And thank you so much, Dr. Sutaria, for presenting this. And we might invite you to come back next time.
Sure. No, thank you. Thank you, everybody, for your time as well.
Yeah, thank you so much. Thank you, everyone. Have a great night.
Take care, everybody.
Bye-bye.